Yes, IVF is a number game. We will have two videos on that. In the first, I'm saying there's attrition from the number of follicles to the number of blastocysts. So when the client comes and undergoing an IVF stimulation, on the final day we say, well, your ovary is good, nicely stimulated, and able to see about beyond 10 eggs or beyond 10 follicles, and all the follicles are 17 to 18 millimeter. We are thrilled, the client is thrilled, we go ahead with the trigger, and then we say take the patient after 36 hours for a pickup. To our surprise, in spite of seeing 10 follicles, we obtain only 7 eggs. So 3 follicles did not have an egg in it. After getting 7 eggs, not every egg is the same. The eggs could be germinal vesicles, the egg could be a mature one, a metaphase 1 egg or metaphase 2 egg. It is only the metaphase 2 eggs which need to undergo an ICSI to achieve an embryo. And this is called a maturity index. Generally, the maturity index is about 80 to 90%, but rarely some of the women, in spite of having 7 eggs, only 2 or 3 can be mature. It's just bad luck. And these mature eggs are then ICSI'd and they have to form an embryo. Not every ICSI'd oocyte will form an embryo. So about the fertilization rate could be around 90%. So about 10-15% could be lost at that level. And not every embryo form can become a blastocyst. Who will become a blastocyst entirely depends upon the genetic structure, the way a blastocyst development is cultured, or the lab conditions and the skills of an embryologist and a doctor. So in spite of saving about 10 follicles, you could just land up having 1 blastocyst. The question is how to correct this in the future cycle, or how not to face this in the first cycle. Number 1, choose the correct drug and the correct dose. Just to reduce the cost of IVF treatment, people land up choosing wrong drugs and low doses. They get lured to, somebody is offering 70,000 cycle or 90,000 rupees cycle, and then they lose an opportunity to use the best of the drugs. So I prefer using majority of my patients on Gonal-F, Menopur or Pargovaris, who are the world acclaimed best drugs for IVF stimulation, and obviously your chances of pregnancy are better. They are a bit expensive, but not hugely expensive. The cost may go up maybe about 20 or 30,000 rupees of the whole IVF cycle. Secondly, an adequate amount of stimulation is necessary. You can't give about 8 and 9 days of stimulation and say, let's give a trigger. No, most of our Indian women are resistant and they do require beyond 10 days of stimulation. Sometimes even a stimulation to 14 and 15 days is needed by resistant patients. So an adequate stimulation that patients has to be maintained. Just to fit everything into a package, if your stimulation gets restricted, well, your end result will suffer. Thirdly, your trigger is very important. Now, we cannot give a blanket trigger to everybody. The trigger has to be individualized. So we have to give a dual trigger, giving GnRH agonist and HCG. And again, HCG injection has to be weight matched. A body mass index matched HCG dose should be given so that adequate serum levels are there and your chance of getting a good mature egg is very, very high. And thirdly, we can't line up the pickups every day of 10 or 15 pickups and the schedule gets disturbed totally. So by the time your pickup is done, a few of your eggs are already ruptured. Your pickup is done beyond 38 hours. No, a pickup strictly has to be done between 35 to 36 hours to get the maximum output. I hope this helps you when you're considering your IVF treatment. Thank you.